Good afternoon, everyone. Bonjour à tous et à toutes. My name is Isabelle Pouliot, and I'm Executive Vice President, Talent, Culture, and Leadership at Pomerleau. I'm pleased to be moderating today's session on mental health in the workplace. Before we begin, I'd like to take care of a few housekeeping things with you. So first, feel free to share your thoughts or comments on the public section of the chat on the right of your video. You can also find the speaker's bio in the session description. And additional resources, including a short survey, are available to you through the session page links. And now, without further ado, I'm delighted to introduce today's session on how to prepare your organization to better support your employees' mental health. Today, joining us, Dr. Ash Bender, staff psychiatrist at the Center for Addiction and Mental Health and director of Workplace Insight. And we're also welcoming Paul Radowski, clinical director and CEO of Inward Strong. Welcome, everyone, and let's get started.
Thank you.
Great, thank you.
So first question to you, Dr. Bender. I think it would be helpful for viewers to start with a bit of an overview of mental health issue, specifically relating to the construction industry. So some issues I've been observing are anxiety and depression. Dr. Bender, would you have some data you can share with us on issues that are the most common in the construction industry?
Yeah, I think that's probably a great start. I think when you look at any work setting, you say, who are the people that really make up your organization, right? Because construction is made of people completing some enormous projects here. And I think if you look at it, it still tends to be a male-predominated industry as well. And with that comes a host of unique mental health challenges as well. I think probably one of the biggest things is to look at is not only are issues like depression probably just as common in men as they are in women, particularly when you start to factor in anger and other emotions as well. You also have higher risk for substance use problems within this group. We know that substance use problems are at least twice as likely as men as well. And then you add on top of that risk for physical injury and the kind of psychosocial situations that people in construction might be in. It's unstable employment. People may come from more unstable backgrounds depending on level of education. So I think it really puts mental health to the forefront. And of course, I think the biggest thing on top of that, and we'll circle around, is just the increased rates of suicide amongst individuals working in construction as well. So I think it really puts a spotlight on mental health and the consequences of not addressing it in your organization.
Thank you. So although I'm aware of that mental health is a very important issue, it actually affects more people than I realize. Seeing those statistics and hearing about those numbers, I'm wondering, Paul, how far have we as an industry come into addressing these issues, and how far do we still have to go?
Sure, yeah, great question. And absolutely, construction would be known as highest, basically second highest substance use for an industry, highest suicide rate for an industry as well. So if I may, I'd like to just answer this question in a high level and unpack some things in terms of what I think is going on there, stigma being a big thing, and just put out what maybe we can collectively do to help understand what's going on better. First of all, I used to work construction myself some decades ago. It helped put me through school and saw back then huge amounts of stigma, substance use. People would say, well, maybe we should inform the supervisor. Well, unfortunately, back in the day, it was the supervisor who was actually the dealer for a lot of these substances.
Yeah.
And so that was 25 years ago. Having done dozens of presentations and keynotes regarding psychological health and safety over the last years, apparently not much has changed. Meeting with folks and attendees, they say, you know, what you're sharing, Paul, is still of a concern, whether it's happening on site, at times it is, or off site, especially more so. And, you know, in my private practice, saw a fellow recent graduate of De Novo Treatment Center. And this is early last year. And he'd gone to several construction sites and organizations and saying, I can't do this anymore. I'm finished with construction. This is just not supporting my health, my sobriety, and what have you. And here's a very highly skilled individual who loved what he, you know, who really loved what he was doing, and needing to step away from construction. It just was not good for his health. So, yeah, I think unfortunately we haven't come a long way. There's still a long way to go. And if I may, those stats are concerning, but they're just statistics. What I'd like to actually do is, if it's all right with you, just take about a minute just to do a bit of a thought experiment with me here. And I just want to unpack the why. Why are you here today? Why are we here today? Why are we discussing this here today? And this really helps maybe understand what's going on for someone. If you don't mind, just bear with me. So unless you've got a lot going on, you can forgo this. Otherwise, I'm going to just invite you just to begin a short simulation with me. So ready? Begin this short thought experiment. And for a moment, I just want you to imagine the worst time of your life. Very worst time of your life. And a lot's going on for you. During this worst time of your life, how are you feeling or functioning? Well, here's the reality. Your lowest level of functioning is, for millions of Canadians, their best. Your lowest level of functioning short term is, for millions, the best they're doing. You just got a taste of what it's like to walk in someone's shoes with a mental health issue. During this worst time of your life, did you tell people how you're doing, or you prefer to keep it on the down low? Well, guess what? If you're like most people, I prefer to keep it in the down low. Well, isn't that what stigma's about? Feeling really beat up, I don't want anyone to know. During this worst time of your life, feeling beat up, don't want anyone to know. What did you do to take the edge off? What would you be willing to do to escape that pain, even short-term, despite a long-term consequence? Well, isn't that what an addictive pattern of behavior is about? Feeling beat up, don't want anyone to know, and maybe we'll use a substance or whatever to help take the edge off. We all have a recovery story, recovering from an accident, illness, or loss. And this, you can imagine, during this worst time of your life, at your lowest point, how focused are you? How much is your head in the game with potentially dangerous equipment around you and what have you? So just kind of finally wrapping up my little bit here. I know I'm taking up some airtime. We would like to, as what was just announced earlier in this session, just we'd love for you folks out there listening to this, just to complete a short anonymous assessment that will provide, we'd like to see the current snapshot, an overview of what's going on regarding mental health and substance use in the construction industry in present time. Yeah, thank you for the question.
You know, Paul, I think that's a great way to circle around. And I think you're capturing that clearly a fundamental, or this is attitudes people have around mental health and their knowledge of what it actually means to be healthy and to get proper help as well. And, you know, it's human behavior to gravitate towards self-medication, isolation. And then a big component is that self-stigmatization. I think often we can be our own greatest critics. Assume that there's not help out there, assume that we'll be viewed as lesser than for having mental health issues. And you know, circling back to you, Isabel, is that these are actually common. By the time someone's reaching 40 years of age, half of us have experienced some sort of mental health issue. It's a dynamic process. And I think all of us can think of those toughest times as well. So I think as we start to venture this, really start to think of, you know, what are the societal factors at play that already create additional challenges when you're coming as let's say a construction organization trying to tackle this on? Do you have the policies, the practices, and the resources in play? And then what do you actually know about your employees? And if we circle around, I think one of the most important things would really try to find out that on the ground level, what do people think about mental health issues in their workplace? What are their attitudes towards getting help? And what do they see as the problem at their workplace? And I think at each employer, there's an opportunity to really try to suss out some of these important issues and to take on a mental health strategy as well. It's key foundational data.
So thank you for that. And actually that leads me to my next question. So in terms of, you know, building a culture, create an environment where people mental health is addressed without stigma, the same way, you know, we address physical safety issues. What would be your recommendation around that? How do we address this with people in leadership position in order to build a culture of openness like this?
Yeah, like I think from first of the starters is the action starts at the top end. One is finding a mental health leader within the organization who is someone of esteem that is prepared to take on that role as being a true leader. That sometimes that means sharing personal stories. That can mean making yourself available and clearly making a commitment to championing through this agenda for years to come, really setting up a sustainable way. The other is also someone in an area of leadership that's willing to put time and resources into it, rather than, oh, it's mental health day, let's do a talk or on this matter as well. And then at the baseline is really getting some of that grassroots involvement that can happen at the occupational health and safety level. Who are your worker representatives? Do mental health topics, conversations, for example, critical injuries, suicide deaths, are those things that are always on the agenda, on the table when you're talking about occupational health and safety? Or are we just talking about physical injuries and attendance? Yeah, so when we look at the joint occupational health and safety, it's not just around physical type injuries that get flagged towards WSIB, also talking around the impacts of the work environment on mental health as well. I think incorporating it into the agenda. You know, I'll circle around to you, Paul, because I know that stigma is underlying this is an attitudinal factor that really needs to be addressed to make it effective.
Yeah, absolutely. And certainly the way I see this, stigma is still alive and well, especially I believe in the construction industry. Typically, there was a huge study called the National Comorbidity Replication Survey. You don't have to remember that. But on average, it took 6 to 23 years, 6 to 23 years for the average individual with one or more of these issues to seek help. So to me, I see this as a marketing issue. It's about basically saying, you know, marketing the resources, first being acknowledging we have issues. There is a thing, the dimension of mental wellness and mental health issues. And in terms of the resources that I think that are available, or hopefully you make available to your staff, marketing those quite often. It's not just, okay, this is a one-time, it's a mental health day, it's September Recovery Month, we've checked off the box. This needs to be an ongoing conversation. And the reality is actually just, it's quite true. The Mental Health Commission of Canada stated that actually half of us will have 2 or more issues by the time we reach 40. The reality is, and COVID has put gas in the fire. Whatever issue was existing beforehand, COVID has just accelerated that exponentially. And Ipsos and Deloitte have done some interesting studies, and actually half of Canadians are experiencing psychological distress right now. So good question, Isabel. I mean, the way I see it, I kind of package it a little like the Mental Health Commission did in terms of best practices. The first step is it's the aware, care, and share. First, you want to be aware and acknowledge there's something going on. If it's with individual, maybe sharing with that individual, hey, Joe, Sue, you seem like, you know, a little bit withdrawn, not quite yourself. You know, how are you doing? For a culture and organization, be aware, acknowledge that there's been lots of stressors, changes. COVID has created an unprecedented time. It's also created unprecedented stress. And I think certainly, as you were saying, Dr. Bender, this is a top-down leadership thing. So awareness is the first step. Care. Show care for if it's an individual level, show that you support them, that you're there for them. You don't want to put anyone on the spot, but say, Joe, it seems like a lot's going on. I just want to know I'm here for you, and just if you wanted to talk. In terms of a culture, show a culture of caring. How supportive are your peers and management? How supportive is the C-suite to them? And again, that's something that needs to be modeled. Finally, share on an individual level, as you share, Dr. Bender, if there could be a champion in one's organization, this helps normalize. You know what? I know I'm the head up this organization, this division. I get pretty beat up with these issues too. If someone's comfortable doing that, it's a bold step to make, but gosh, this really has an impact on culture. You're normalizing for your staff. You're modeling for them that it's okay to talk about this. You want to share that you have resources available, a variety of options that are available. For an organization, culture, same thing. It's a top-down issue. You want to model of being aware, care, aware, being acknowledging of the fact that stuff's going on, caring, and the sharing, let's say, is, hey, folks, we've got resources available. And they're immediate, they're 24/7. We're trying to remove as many barriers as possible.
Yeah, I think, Paul, you're bringing up, I think, all the key parts. You know, the big challenge is what you say and what you do as well. So do you really stand behind it with your policies? And I would invite every organization to go through and review their policies and see if they're discriminatory in some way. We do have human rights legislation to guide us here as well, but I know lots of progressive organizations have had to look back in retrospect and do an analysis. Have we addressed mental health discrimination in our hiring practices, in our disciplinary practices? Have we provided adequate training to supervisory staff to ensure that they're managing it as a mental health issue and not just a performance issue as well? And then the other kind of commitment, it really undermines it, is the rumor mill. Is, are people really taking meaningful steps to respect confidentiality? And I think that's probably one of the differences in people who are trained in understanding the respecting confidentiality is key. I mean, I'm a locked wolf. The amount of secrets that I have as well. Could you imagine if I was sharing those with others? It would lose complete trust in me and the process as well. So, you know, there are some other important factors that help organizations to move forward and say that they're taking it seriously as well.
All right, so thank you for your insight. In terms of, you've talked a little bit about reviewing policies and programs. You've talked about accommodation and possible discrimination. How about training? What training would you recommend? And how about mental health first aid training? Could you talk to us a little bit about that?
Yeah, I mean, I think, and I'll have Paul circle around. Certainly one of the key areas is really looking who really has a face time with your employees as well. And most certainly it's direct supervisory staff that need to be trained in that area. But the other part is peers as well. Now, mental health first aid is a pretty straightforward concept. Is how do you respond to someone in psychological distress? And equating to that, how would you have a designated person to respond to physical injury in the moment as well? So this concept is having either a crew member or supervisor or someone in an accessible managerial position trained to respond to employees and colleagues. It could be actually superiors as well, respond to them in distress. So knowing on at least how to engage them, provide some sort of sense of comfort if they're in crisis, knowing, hey, this is where I need to guide someone towards emergency or crisis services, or this is someone who I can ensure has a safe ride home to a family member or other caregiver as well. And then knowing, hey, these are the kind of supports and resources available in our organization to provide a response to you. And these are also community ones, and perhaps sometimes circling around and making sure those connections are made. Often it's an individual that's either a peer or a direct supervisor. There are some formal training in this, because I think well-intentioned people without training can make mistakes or sometimes find themselves pulled in too much without being able to set boundaries, where getting this training really gives them that skill set to respond in the short and appropriate, just like you'd want to train someone in St. John's first aid as well. It's an excellent start.
Thank you. And a little bit, I guess, a little bit off chart, I would say, I'm trying to think, how can we bring leaders to share about mental health a little bit along the line of what you've mentioned, and to show their own vulnerability when they feel a lot of pressure, especially right now during COVID, to cheer up people? How can we help them reconcile the two, actually those two aspects within their role, and help them to come forward being comfortable doing it?
That's the golden question, isn't it, Paul?
Yeah.
Yeah, I mean, I think one of the things is that actually leaders need training on how to be mental health leaders. You know, I did a session with the provincial government and the directors and a lot of the heads in the various areas. And, you know, a simple scenario was, and we were talking around the role of alcohol support services for staff. And this question came up, you know, what do you think about an AA meeting at site? And almost invariably, most of the people are saying, we wouldn't want to have an AA meeting on site. No one would want to attend that. And we use that as a great kind of case study to circle around and explore the attitudes people had around people seeking help or support or maintenance against relapse around alcohol. And once we did that, a lot of them changed their minds and say, hey, you know what? It would actually be a great idea to have a designated safe spot to say, hey, for those who are committed to maintaining their sobriety, we've made this spot available on site because we value that. And the importance of some of those messaging and those decisions. So that was a great example around getting leaders to examine their own attitudes. The other thing we really said is trying to, almost every leader will say, hey, this is an important thing that's affecting my organization. Then I'll say, okay, so what's on your agenda right now? What projects do you have in the books? How much money do you have designated towards it? Asking the tough questions. And then making them commit to some sort of initiative or project along the way, knowing there's a business case for it as well. And those are the kind of things, just an example, and Paul, I'm sure you have some as well around mental health leadership.
Yeah, absolutely. And here's the business case. You know, aware of the stats of the prevalence. This is a pre-COVID stat across industries, but these issues are costing organizations 14%, 14% of your net annual profit. And we're talking absenteeism, we're talking presenteeism. You know, these are the 70% of the most, you know, biggest costs in terms of organizations. And that is $1 million question indeed, Isabel, in terms of the leadership. It reminds me of just a short story. I was doing a presentation in Winnipeg, actually, and I shared a flight with Michael Landsberg, who happened to be there. He was also doing a keynote. And I thanked him for, you know, most people acknowledge him as a sports this guy, but I really just cheered him on as thank you for changing the mental health landscape over the last number of years. So we had a really rich conversation. We both actually were staying at the same hotel, so we shared a cab ride as well. And I basically said, Michael, so what's changed? What do you think has changed over the years with your talks, the Bell Let's Talk campaign? There are stats showing that it has improved. So thankfully that is the case. This was some years ago. He says, you know what, Paul, I'm not sure of how much it actually has. And he shared that recently he did a presentation for clinicians, a group of 60 clinicians. And of course, we know the prevalence. 1 in 5 of us will have a mental health issue now in the next 12 months. That's the annual prevalence. Half of us will have 2 or more of these issues within our lifetime, around the age of 40. So show of hands for those of you clinicians out there who ever struggle with any of these issues. And he says, you know, 0 hand was raised. He says, well, you know what? I'm not going to call you out on your bull poop, you know, but I'm going to share my story of what I'm seeing going on here. So stigma, it's still alive and well. I think what Dr. Bender was suggesting, a psychological first aid would be useful. Having a committee, an internal, maybe mental wellness committee. Let's talk about strength. Let's change the marketing of it. You know, mental strength, mental wellness, what have you. And some organizations I've consulted with who are doing better, and I've been a part of some of these committees as well. They have an internal committee, people who are dedicated to meeting at least on a monthly basis. What are some initiatives we're going to spearhead? What are some challenges we're seeing? How are we going to market our EAP, other resources that are available to folks? And again, modeling. There's a sense of let's lead by example of what's going on. The biggest question is the leadership willing to step up? Hey, we know half of us have these issues, you know, and it's either a direct effect or an indirect effect to those around us. So I would challenge you, if you're a business leader out there, I know it's a scary move for sure. However, I just want to applaud those who actually do take the courage to do so. You know, once you cross that threshold, I think you realize just how emboldened you will make yourself and those around you by doing that. After I do a presentation, a mental health presentation, be amazed. People may not necessarily comment in the presentation, but people are so hungry for this information.
Yeah.
People are so hungry to say, you know what, can I share with you a story? You know, this is, of course, after people are leaving and just, you know, just nice to meet you as a presenter, nice to meet you as a participant. And gosh, that just helps open the door. It just helps model, it just helps normalize, helps validate that, you know what, maybe I'm in a position of leadership. I'm human and I can get pretty beat up as well. And I've seen it done many times with always positive results. Can feel a little bit unnerving initially, but it can really help keep this conversation going.
Yeah, I mean, Paul, I think of it as a cost recovery agenda. The money is already being spent on the mental health issues. They're prevalent, they're enduring, they'll always be there, and they've always been there as well. So, I mean, whether you're greedy or altruistic, and you're coming to the same conclusion around, is this the right thing to do as well? I just think in the construction industry, there's just a lot of challenges with transient workforce. The other is lots of subcontracting happening. So there's a lot of people that are seemingly part of the organization working in small businesses that may not themselves, small shops, have that kind of infrastructure as well. And perhaps this is where the Canadian Construction Association and things like that have an important role of showing leadership in this area and setting standards around good mental health stewardship for this area. Healthcare has had its challenges as well, right? And we're just as guilty around reluctancy to come forward. So I think a lot of us are recognizing the problems. There are some key initial steps that we can make as part of this strategy, that if you take an essential role, tackle stigma first, and then your next role is putting some money behind proper resources. The other is committing to collecting data. You keep doing that every year, 5 years from now, you're going to have something much more robust. than you do now. And there are some prescriptions to follow in this process.
Yeah, and if I kind of just jump in, it is a cultural thing, isn't it? It is about the culture. And that, again, is often a top-down thing. And it is a challenging culture in terms of just, I think, especially with construction and trades is breaking through that stigma. I know there's a recent survey done, I think it was 3,000 CEOs, I can't remember the source, but 70% of those CEOs say we're putting our people first. Because we realize when we put our people first, our profits follow with that.
Yeah.
Our people are, you know, our main, the most important thing for our success, basically. Actually, senior leadership from Ledcor says we are never going back to the old ways of how we're doing things and just ignoring, let's just, you know, just in terms of the priorities of people, especially now with COVID, as mentioned, huge gas in the fire in terms of these issues. And it's this topic has never been more important than now.
I wonder if, you know, I always circle around to the suicide, and I just see it as, and the reason I do, I mean, like Paul had construction, and we had a family concrete company. And the reason that I'm in this industry is we actually had a suicide at our workplace. And this happened 20 years ago. It was a devastating young man who died on site in one of the batch mixers. We'll never know what happened, but to see the impact not only on, it's a family business, his father was an employee there, all the staff, you know, my dad and uncles, and it really took a year to recover from a production point of view. Nonetheless, all the emotional and psychological fallout from that as well. So I wonder if making a commitment around saying we want to reduce suicide rates in our industry, setting that kind of ambitious agenda is going to take you down that path of doing all the right things, addressing attitudes, barriers to seeking treatment, making more robust resources for substance use, really tackling on making psychological services for workers who may not be able to access them normally, depending on their benefit situation or whatever that may be. I think taking on something robust like that is definitely going to lead you in the right direction.
Yeah, and if I may, thank you for bringing up suicide. I think it's one of the last taboos. And again, pretty much highest in all industries is construction. So, and it's kind of what came first, the production, you know, chicken or the egg, production or the emotional impact. So I used to do critical incident stress responses. You know, I was the guy who was called in just after emergency services left to just debrief what was going on. And you can imagine an issue like that is going to really just do psychological damage. And of course, that's going to impact the bottom line as well. And as I kind of did this simulation earlier, imagine the worst time of your life, you know, stigma, I don't want anyone to know. What am I willing to do to take the edge off? Well, maybe use a substance. But you can imagine if this is the worst time of your life and nothing seemed to be working, and I was maybe not cool with getting help, maybe there's just too much stigma. What if you couldn't get past that worst time of your life and you felt stuck and hopeless there? What would you be willing to do, in desperation even, to end that discomfort? That's the reality of suicide. And unfortunately with COVID, they're called deaths of despair. The impacts of COVID will be felt, the psychological distress impact, what have you, will be felt for years to come. This is whether considering an uptake in the deaths of despair. Whether that's active suicide, opioids. Opioids are a huge issue, fentanyl, people overdosing. Was it an intentional overdose? Was it an accidental overdose? Not sure. You know, and this is where you mentioned, Dr. Bender, resources aren't just a nice to have and need to have, they are a must have. The unfortunate reality is EAP uptake, employee assistance providers, only about 5%, and 2/3 are actually women. So you might get 2 out of 100 men actually accessing an EAP. So you do want to maybe explore options that are as barrier-free as possible. Unfortunately, these issues will be escalating and continue to be at a pretty high plateau for quite some time, unless we do something about it collectively.
I'd really like to see, like Paula, and I think, you know, you look at EAP utilization, you know, that's one data point, but also putting resources to the test. Do they actually produce the outcomes that you're hoping for? So I think setting some hard data points around reducing, you know, lost time from work, improving the number of people that are accessing treatment, the number of managers trained in mental health initiatives, the size of a peer support program. I think said having it data driven is really going to be an important aspect of guiding you, knowing that it's not going to be a perfect system, but it's going to help drive the direction where you go, particularly when we're not talking around additional funds appearing from nowhere. A lot of these initiatives are going to involve reallocation of funds. Do we need all this money going towards chiropractic care, or does it make sense to direct some towards psychological care in the basket of resources that we have available to us? And I think this is going to help with smarter use of money and probably reallocating it to places that are actually matter in this case. And mental health has been neglected too long for that reason.
Thinking of smaller employers who may not have the resources to be tracking and collecting some of that data, I'm wondering, like, really focusing on making people aware, you know, breaking those barriers, removing the stigma, and creating that culture of proximity where you're actually showing you care as a leader, whether you care as a leader for your success, for your future career plans, or for your mental challenges. So again, I'm asking how can we bring managers to put mental health on their agenda, in their leadership toolbox, and appealing to them, because it's not just about the employee that has the problem. If you create that proximity, you're actually going to be creating the proximity and the engagement and the enthusiasm with performers as well. But then the door is open for the day where people need the support.
Yeah, I mean, one of the examples would be with the Ministry of Labor mandating that every organization had to have an approach to managing post-traumatic stress disorder for their first responders and other people as well. Now, you could imagine that can be vary in size from large metropolitan cities like Vancouver, Toronto, where I am as well, to very small groups such as volunteer firefighters working in whatever rural community as well. And the approach, and we help to develop some of a framework, is actually building out what does a good mental health platform, what do good policies look like at place, what are the essential components, and what is available to you in your area that you can realistically implement now, and where could you take things? What direction could you go with this kind of platform as well? So we really put together a toolkit that allowed them to take into account the size of their organization and all those factors as well. And I'm wondering if there's an opportunity at the association level to try to set some standards on these are the key ingredients, things that we recommend. Here's some examples of good policies, good resources within your community to create those kind of partnerships. That's going to help some of the smaller shops navigate through this, because we tend to think too much around just the large corporate style organizations, which are the smaller number of employers when it comes down to it.
Sure. Actually, maybe it just kind of way of highlighting action steps, and just completely agree with what you're sharing, Dr. Bender. And again, now is the time. These are leadership issues that start with leadership. and knowing what the resources are available. I often ask this with organizations, on a scale of 1 to 10, how would you rate your organization's psychological health and safety score? 1, not good at all, 10, the best. What would you rate on a scale of 1 to 10, your organization's psychological health and safety score? And you might have a number in mind. Great. Next question. How would your average employee rate your organization's psychological health and safety score? Your average employee, how would they rate the mental wellness, how mentally healthy your culture is? What would be their response? What would be their number from 1 to 10? 1 being non-existent, essentially, 10 being the best. And I'm wondering if there's some disparity between your response and your average, employee's response. Most people tell me there often is. So take an average of those two numbers. Average them. What's that number? That being said, so that's maybe your current baseline. What can you do about it? What would you like to do about it? We've talked about how important these issues are. What's one thing you could do to raise that score by a point or even half a point higher? Is it something perhaps from this panel? Is it something in terms of a resource that might be shared through the CCA, through other organizations? What's one thing you can do to raise that point higher? And what we'd like to do is we'd love to get your feedback and basically assess where things are currently at with the construction industry, again, with an anonymous assessment and collecting metrics just in terms of the industry, and something that, again, it's anonymous, but would be willing to share with the CCA and your organization if so desired as well. We'd really want to be able to just provide as much support for this, I would say, very challenged industry. Highest suicide, second highest substance use. And here's the way I see it often. You got high stigma, you got high substance use, but I'm not talking about my issues. I'm going to self-medicate. The stigma's keeping me from doing that. I can't help but wonder if that leads to a higher suicide rate as well. And I think these issues, again, is the perfect time. It's a perfect storm. Right now, it's basically a mental health epidemic. Let's do what we can to keep our people well and strong.
Well, isn't that a great agenda for a mental health champion in each organization to commit to some data collection and asking that question of their employees? How good are we doing in this area? What's missing? And really setting that agenda. Similar to that, like police did a similar survey amongst their group around mental health in their organization. They had a 50% response rate to that survey amongst 30,000 officers. They had 15,000 respondents. That's anywhere from 2 to 5 times the normal response rate that you would get when you put out surveys. So that alone said this was a key agenda. And as Paul circled around, this is important to people. I think you're going to get people responding to this and really starts to break down those attitudinal barriers by putting this on the agenda.
Talking about surveys, so to what extent do you recommend the use of survey to pulse employee to measure progress? Is that reliable or anecdotal?
First of all, there are developed surveys. So for example, there's Guardian Minds at Work, or there's other well-established organizational instruments. So I think the key part is this doesn't need to be reinvented as well. There are some organizational measures that are really designed to ask employees and not just employees, but also you got to measure on all levels, because you can't just assume that it's the bottom level employee that's the only one that's struggling. Often it's middle management that are just as much of a crunch, and sometimes all the way and up at the top as well. This is something that has to be implemented across the board, and everyone should be invited to participate and encouraged to do so, to do it. And then also this would be one of the first steps is what's the right instrument for this industry, and is it capturing the right kind of information that we need in order to set an agenda and an action plan. Paul, what are your thoughts? Did you have certain favorites?
Yeah, their particular assessment is also capturing guarding minds at work is useful. We're trying to gauge the degree of readiness, alternatives that people might actually engage in. So a little bit off the sort of standard surveys that are currently being done. My hope is, and perhaps not so much in terms of an assessment form of this type, in terms of just what's currently going on, but if I could just kind of echo what maybe was been said earlier, is hopefully this isn't just at the upper level. Of course, upper level folks need resources, need supports as well, and certainly an understanding of what's going on and in terms of their organization. What I often see is the gap between what's going on up here and the frontline workers, of course, who are obviously in risky situations and remote situations, often being injured, often having lots of challenges, as you mentioned earlier, Dr. Bender, just given the nature of their work. I'm really hoping if I could just kind of, let's say, just make the importance of, I'm hoping this information not only is heard by your ears in terms of who is currently hearing this particular presentation from an HR more senior management level. My hope is that this information does get translated from this level to the folks on the front line, because that's what we're really, that's an important part of who we're talking about here. And unfortunately, I still see that gap happening. So, and whatever way those folks can be reached through assessments, through it, just education workshops, through just basically awareness, kind of being aware, care, and sharing the resources that are available to the folks on the front line will make a difference to your bottom line.
Yeah, I mean, the question is how you get that data. I've had a couple of projects. One was within a large transit organization. The other was in a large hospital. The best information I got was through doing focus groups in key sectors. So, for example, one was in a focus group amongst managers, and the biggest, and trying to understand what were the barriers around understanding the impact of psychological trauma on nursing staff and other care providers, and the barriers to seeking treatment. One of the issues was a fundamental distrust of senior management that came out of it, and a perception they didn't care because they weren't necessarily present when crises were happening. We're talking like serious injuries and things. And that really set a foundation on how the senior leadership chose to engage with their staff, and they actually set up funded psychological treatment for their nursing staff and others. 100 people utilized it in the first month. The other thing we did was with subway drivers, and we picked a particular sector where suicide was very impactful on that, often riders and suicide. And just understood what were some of the mistakes being made in responding for crisis, and getting these really granular experiences from drivers who'd been through it, managers who'd been there, other first responders who'd been through that process, gave us such incredible information that helped us to drive a program to address that issue. So could be a combination of broad surveys, but also doing focus groups and getting that. The impact of that is it really felt real to the employees there, that their leadership was taking it seriously and wanted to hear how they were impacted by it. So that's just another example of how to get this kind of key data.
Let's do so. Thank you, Paul and Ash. This was very insightful. Maybe a final question, thinking about people in the audience from smaller organization, or even maybe leaders in larger organization, but that want to take immediate steps without waiting on their employer to take on or adopt a formal program, what would be practical advice that you would have for them, how they can have an impact immediately on their workforce?
I mean,
so,
I can.
Paul, you're on. Oh, okay.
Paul, go for it, Paul.
Oh, I was waiting for Dr. Bender.
Come on.
I'm still percolating here.
Okay. I mean, I can. Okay. There's some advantages of going first. Who knows? You know, the first thing I think is small, medium, large. We talked about it. Who's going to be your, pick a mental health champion, find a volunteer. There's someone going to be there. At least make that designate. And things that I think would be key is pick one area that you'd like to change. Either it's connecting with some community-based mental health resources, whether it's reviewing a certain policy around, let's say, mental health accommodation and return to work, or, hey, we want to set up a peer program, picking one agenda to try to tackle off, to take on, I should say, because in doing so, it's going to become readily apparent what your next step is going to be after that as well. And putting that on the agenda is going to be start of the path of going down to improving the conditions in your workplace and hopefully improving the physical and mental health of your employees, managers, and seniors as well. I think that would be really where I would start as well. And we can always provide plenty of ideas of where you can go with that as well. And I'm sure, Paul, you have many ideas to propose.
Well, and totally second what you're I'm picking up what you're putting down, Dr. Bender, for sure. It was awesome recommendations.
That's the idea.
Yeah. And certainly there was a systematic review done some years ago and predominantly male industries. So this is about as construction centric as you can get, construction centered. So, and the recommendations, best practices were, first of all, improving mental health, knowledge, and literacy. And I think what we're kind of starting to do today. You want to increase social support is very important, especially those living in remote areas or working in remote areas. You want to improve access to just getting supports and treatment. And for the managers out there, you know, it's about educating yourself. It's not about diagnosing. It's not about assessing someone. I think that maybe the first immediate step you could do is just show that you care, be present to your staff, show that you care, and show that you're, you know, kind of wanting to model something different, and that you're there for your people, and to just be an example of a healthier culture. Ultimately, you know, we're talking about people here, and along the entire line and dimension of mental health versus not so healthy. So. Yeah, just be present to them, just kind of hear your people out. And as Dr. Bender also mentioned, you know, resource yourself, see what resources are around you so you can resource your people.
Well, thank you very much. This was extremely rich in terms of content, lots of expertise. Clearly, you guys care. You care a lot, and this is, I think, what we want to retain from what you've said and what we want to pass along, right? So thank you very much, and I hope everyone in the room has enjoyed this session. And obviously, resources can be shared, I guess, on the site of the conference for future references. So thank you again. Have a great afternoon.
Thank you.
Great.
Pleasure.
Thank you.